So Donna and Julie are going to talk about their histories, and then maybe we'll ask a few questions if that's okay?
Yep.
Okay, so who wants to go first?
Julie. I'll go first. I'm Julie Rieken. I am from Arlington, Nebraska. And so I'm going to actually talk about diarrhea. So a lot of you can identify with some of the issues that I was having. About 11 years ago, I was in the process of being diagnosed, and I had horrible diarrhea, uncontrollable. I've told a couple of patients here, it doesn't ever hurt to have an extra 20 pounds on you, because I can lose 20 pounds in a couple weeks when it hits. So long story short, I went to a lot of different doctors and eventually found it on an endoscopy. I went in and had a CT scan the next day and got a call from the doctor, not from a nurse, so I knew it was bad news, from a doctor, and said I had a mass on my pancreas and spots all over my liver. So I was stage 4 from day 1, and my diagnosis was actually for a VIPoma. VIP is vasoactive intestinal peptides. So it's what caused me to have such horrible, horrible diarrhea. So pretty soon I had sandostatin, and that was like a miracle. So it worked really well for me for a while. And then, like we've talked about, cancer gets smarter than whatever medication you're on. So I consulted, I was just seeing doctors in Omaha. They said I was inoperable. So a lot of you have had that happen too. But I asked to be referred, and I ended up going to the University of Iowa. So Dr. Thomas Odorisio was my doctor at the University of Iowa. Complete genius. Anyway, right away they scheduled surgery. I had surgery in 2015, continued on sandostatin, eventually again. My surgery was to remove the primary. It was about the size of a lemon on the tail of my pancreas, and then remove as many spots on my liver as possible, but it was all over. So basically, fast forward, I was eventually, my symptoms were coming back again. I'm doing octreotide shots 3 times a day in addition to sandostatin. And then I ended up having some pretty significant progression in the hospital, had a bland embolization. That was really fun. And then, so because of that, I was recommended for PRRT. And so I had the Lutathera RRT in 2017 into 2018, right as it was being passed in the United States, but I was having it in clinical trial at the University of Iowa. And so I think Dr. Shawan was saying that patients sometimes get sick with PRRT. Yeah, so like the first couple, I really kind of went into crisis. And we kind of made arrangements for me to have fluids and so forth. So that was helpful. But as I had more treatments, it got easier. And by the last one, I really didn't have many side effects after the treatment. So that was good. I had 18 months of stability after PRRT. So that was really good for me. But again, then it started creeping in, and I had another progression, and I was recommended for liver transplant. So in 2020, I actually, on May 15th of 2020, I got the phone call to come in and get a new liver. And so my husband dropped me off at the door because it was in the middle of COVID. So 7 days later, he picked me up with a new liver. So it was okay. Honestly, there are times, I'm sure some of you that have had to be in the hospital, there are times where you prefer not to have visitors, and that was okay. I was able to rest, and the nurses were fantastic. So I was doing okay. So then I was actually no evidence of disease, or so we thought. They warned me that it would come back. So liver transplant just resets the clock. But you know that this cancer is so smart. And so it has come back. It's in my lymph nodes. I have a small spot on my new liver. I still go to the University of Iowa, and I just recently completed treatment for alpha PRRT using lead as the radioactive agent. I just saw Dr. Dillon at the University of Iowa on Monday, and all of my tumors are either stable or shrinking. And I have one on the one on my liver that we're really watching. If you look at it, it's white on a CT scan, except the middle is black. And he told me that means it's dying from the inside out. So really, yeah, really good response. And Dr. Dillon is really pleased with those results. And the other thing that's exciting about this type of treatment, the alpha PRRT is, it's a hard-hitting thing. The exciting thing about that is that it will continue to work for about 2 years. So I'm really looking forward to, all the things that I can do in 2 years to really enjoy life. And then, just all of the things since I was diagnosed in 2014, and Marion can say from 2001, all of the things that have happened in that period of time, it's just impressive. So hopefully this will get me through to the next thing. And, just keep enjoying my life. I am one side effect to the alpha PRRT that I'm dealing with is I have by the way, I'm also on Afinitor. But I have very high blood sugars right now. And so we need to get that all under control. That's a problem. I'm a little fidgety and, it's not stopping me from eating a brownie after lunch, but but we know that I need to get that under control. But that's something that we can figure out, and so that I can really enjoy the next couple of years of hopefully stable disease. So that's my story.
Okay. So my name is Donna Hayes. I also was diagnosed in 2014. My story is a little bit different. I was actually accidentally diagnosed, which happens occasionally. Ended up having surgery, and things were kind of done a little bit different than someone who knew what they were dealing with. Ended up having my surgery, then was referred to an oncologist who ran the octreotide scan, which was the scan back then, lovely scan that it was. And we are fortunate, as we said, there's...
3 days like this was not fun.
No. The scans today are so much
Absolutely
better in more ways than one, not only in detecting, but also the patient being more comfortable, I guess you could say. So I had my surgery, and then the surgeon referred me to a local oncologist who referred me to Dr. Warner, who Marianne showed the sign, the picture of him. And he reviewed everything, put me on sandostatin, and I was stable for a number of years. And then in 2020, so that was back in New Jersey, my husband and I relocated to South Carolina in 2017, I think. No, later than that. Anyway, 2020 on a scan, it was showed that I was told I had a rogue lymph node in my chest. Was sent to the radiologist oncologist, had some surgical beam radiation to that node, which stabilized it. And then I was doing pretty good all along, and then ended up having to have a hysterectomy, which we thought one thing had nothing to one thing with another, and it turned out that my ovaries were involved. So they removed the ovaries and obviously had the hysterectomy, then had more scans, and it was determined that it had metastasized to my liver. So then I went and had Lutathera, which I decided to do in Kentucky. with Dr. Shahan, actually started the treatment before he left to go to Miami. Had my 4 treatments, and I have to say that I didn't really have a lot of complications with the Lutathera other than more substantial pain, but I was told they were poking the bear. They were making that tumor angry, that it was being killed. So had my 4 treatments, and I did have other, being tired, some hair loss, but things that are easy enough to deal with. Right before my 4th treatment of Lutathera, though, I started having really severe abdominal pains, followed by vomiting. Took a little while for them to finally figure out that I had a partial blockage. So what's that?
How long were you on that liquid diet?
Oh, about 4 or 5 months. Dr. Anthony, who was in Kentucky when I went for my post-scan Lutathera, is the one that found it. Talking about doctors and when to make your changes or whatever, I had scans prior, and they kept telling me everything was fine. But nobody could explain why I was having this pain and vomiting. It was like a 2-week cycle. But anyway, so I said to Dr. Anthony, well, what do we do? He said, you could stay on a liquid diet for the rest of your life, or you can have surgery. And I said, well, liquid diet is not going to happen. So I said, where do I go? And he referred me to Dr. Mary Maluccio, who not only removed the blockage, she also removed a lot of the tumor burden for me. So again, the term, she reset the clock for me. I lead a full life. I am scanned every 6 months right now, and we are in a good place. Hopefully we'll stay that way. I try not to let it define me. Obviously, when you come up on scans, you get a little nervous, right? Everybody gets anxiety. But, I try to live my life and enjoy life to the fullest. And that's, we can live good lives. We can have, happy, successful lives. And, right? I mean,
Yeah,
11
yeah.
years and we're going strong.
Yep.
And don't have any plans on stopping. So.
So I kind of went over briefly about my diagnosis. I was misdiagnosed for 7 years. I was told I had irritable IBS, ulcerative colitis. Let's see, I was crazy, which we all know I am. And Robert and I went to a doctor, and the doctor, as Robert's sitting there holding my hand, the doctor actually had the nerve to say to Robert, have you thought about going to marriage counseling? Robert said, excuse me? He said, I think all of Mary Ann's problems is that maybe you're in a bad marriage. Well, Robert, if anybody knows my husband, he's very, very calm. I'm willing to take, he's calm. He stands up and says, I hope you don't expect us to pay for this. And we walked out the door. But but I was literally bleeding from the rectum so bad that they were actually giving me blood transfusions. And they were telling me there was nothing wrong. Now, growing up, my kids laugh about this. Growing up, if they took a shower, the door had to be unlocked in the bathroom. I had a one bathroom house. And so it was like, okay, well, mommy's gotta go, she's gotta go, so you have to unlock the door. Now we moved down to South Carolina, and now we have 3 bathrooms, no kids. But, so we went through hell getting diagnosed. I mean, I fired 7 doctors. I had 7 colonoscopies, 7 endoscopes. The last doctor that diagnosed me was a local little GI doctor, and I said to him, I'm in the office, tears coming down my face, I'm doubled over in pain, and he said, I'm going to do a colonoscopy and endoscope. He said, had anybody ever used a pediatric scope on you? I'm like, what? He's like, yeah, it's longer and more flexible, and I think I know what's going on. And Bob and I just looked at each other and went, hey, listen, can't get any worse than this. So I said to him, okay, here's the deal. You can use that, but you go in there and you don't come out until you have an answer. He said, okay. And so he comes out and he had right here this big smile grin on his face and goes, I found it. I'm like, oh, thank God. What is it? He says, I'm not going to tell you until we get the biopsy back, but I think it's okay. So he called us up and he said, we went in, he told us what it was, and we got a surgeon, and that was another nightmare. I was scheduled for surgery, and my doctor was on a red eye coming home and didn't bother calling anybody to tell us that he was on a red eye coming home. So we ended up canceling the surgery after stalking for 3 days, and then I finally had the surgery in May of 2021. 2021, right? No, 2001. So I had my surgery. I had right hemi, appendix out, 6 months later, after being on Sandostatin, of course, I had to go back in to have my gallbladder removed. And then I was good. I was stable. I did have other metastases. I have a spot in my lung that we've been watching for years and things. In 2019, I had gotten a hiatal hernia, and from straining going into the bathroom, you sometimes will get a hiatal hernia. Well, I had one that was so bad, it was 1/3 of my stomach was in my esophagus.
Oh.
And every time I went for a scan, the doctor would talk about it. And I wasn't telling him for 10 years I was only eating one meal a day because I couldn't eat, because I couldn't digest it. So he's like, Miriam, we really need to take care of this. And when we're in there, maybe we'll get another surgeon to clean it out. And I was like, okay, well, if you have to. Which now I look back and say I really should have done them separately, because it was a really big surgery. I went in and they took out part of my mesentery, lymph nodes, 2 resections of my small intestine, 2 hernias, a liver resection, and the hiatal hernia. So I had that in 2019. But I had syndrome so bad that I was actually on 4 injections of Sandostatin a month for over 8 years, okay? After 8 years, I had to give myself sub-Q shots. So I was giving myself 4 injections a month and then 2 to 3 sub-Q shots every single day on top of that. So Dr. Waltering and Dr. Odorizio talked, and they made me go on an insulin pump that was filled with octreotide, which was great. However, it wasn't covered by insurance, so you had to pay $4,000 for this little pump. And but it was well worth it because it was saving my life, and it was stopping me from having nonstop crisis. I have died on the table several times and been brought back by a drip of octreotide. So it was very serious that I needed to make sure that I was getting my treatments. And so I did that, and then after my surgery, they said, well, you know what, let's try lanreotide. I tried that, but I also have lupus. I got diagnosed with my daughter, when I was pregnant with my daughter. So my platelets go up and down and things like that. So I'm not a candidate for some medication. So, we had those kind of issues. So after 2019, when I went on the lanreotide, I had the side effects of joint pain. So bad that I thought my lupus was back. And so I stopped the lanreotide, and so I went back to giving myself the pump. Unfortunately, the pump burnt out. And nowadays, back then they didn't have all the little attachments to measure anything. It was just a little pump. Well, I went to go try to replace it, and now it was over $10,000 not covered by insurance. So Marianne decided that she was going to give herself sub-Q shots again. And so I was doing sub-Q shots, and now I am on clinical trial. I don't want to go into it, but it's doing much better, stable, I believe. I go back to Kentucky next week, and it does control my syndrome and stuff like that, and so far everything's been stable. But, if I didn't have those doctors that looked outside the box, I wouldn't be here, because they were like, okay, well, we have to find how to control that syndrome. How to keep her blood pressure under control. If I didn't have those specialized doctors, I wouldn't be here, okay? Many of you know some of the old people that are here. Trisha, my daughter, who's outside, also has it. And she was diagnosed at 22 years old, only because I was so alert of what was going on. Every time she ate, she went to the bathroom. She was always bright red. She was always having intestinal issues. We were in Louisiana with Dr. Waltering and having the national conference, and I said, I want her tested. And he said, oh, don't be silly. And I said, I'm telling you, this kid has neuroendocrine. And he said, all right, I'll do the blood work. We did the blood work, and it was 1 or 2 points off. But he was like, oh, we'll check it in a couple of years. And I just did not feel comfortable. I was like, I'm not going to have this child go through 7 years of unknown. And I took him to my GI doctor. And I said to him, he said to her, hey, Trisha, I'm going to do an endoscope to see if it's something else. And he said, in 3 years, Trish, I want you to come back here and have a colonoscopy. And Trisha just looked at him and said, no, that's not happening. She said, are you knocking me out? And he's like, of course I'm knocking you out. She said, okay, when you knock me out, you do the colonoscopy at the same time. And so they did that. And he took 25 biopsies in the stomach and 25 biopsies in the small intestine. 10 days later, we still hadn't heard anything, so we thought, wow, we're safe. Unfortunately, at the same time, Hurricane Sandy had hit, and Trisha's biopsies and stuff got lost because the office had gotten flooded. And so on Michael's, I don't remember which birthday it was, but on Michael's birthday, we got a call from the doctor, and he said, normally I don't do this over the phone. He said, but I don't have a choice. And he told us what happened, and he said, we'll work on it. And Trisha was leaving for college to Johnson Whale in Rhode Island in less than 10 days, and Thanksgiving in between. We got her MRIs, her CAT scans, another endoscope, ultrasound, and an octreotide scan, and an MRI, all done within a week. Thankfully, she had the tumors in her atrium, in her stomach. She had several of them removed, and again, she had more. Unfortunately, then in 2015, we thought she was safe, and in 2015, she started gaining weight and ended up with Cushing's and a pituitary tumor, which turned out to be next. Trisha had a daughter, has a daughter, 7 years old, and after the baby was born, we moved down here to help. When the baby was 9 months old, Trisha started having symptoms again, second pituitary surgery. So, we have done a study at NIH. We are not familiar, we are not genetic, granted, it just happens. And all the specialists who thought I was crazy said to me, Marianne, we probably found the disease probably 20 years before anybody else would have found that disease because I was so in tune to it. Is that genetic? Is it genetic? Is it familiar? Yes, we have a lot of families that have it, but in makeup, they say about 30% have a chance of passing it on. Is it something that you need to learn how your children do? Absolutely not. But if you just see signs in your children, why not ask the doctor to run a little test? The other thing I want to talk about is self-care, okay? I know you're all patients. This is for you. I know you're all dealing with the nets and you don't want to deal with anything else. Please go get your mammography. Go get your pap smear. Just because we have nets does not mean that we can't get anything else, okay? So I'm begging you, please make sure you stay up on the test. Please continue going for your CAT scans and stuff like that. 10 years later, 20 years later, it was 19 years later I had my surgery. So it can come back. It might not come back in 2 years, it might not come back in 5 years, it can come back in 20 years. So stay on top of it, don't ignore it. And if you feel something, go to the doctor. Don't assume it's the net. There could be something else. I have a patient that is a net, and she also has colon cancer. And she just assumed all the stuff that she was having was related to her small intestine net, and it turned out she actually had colon cancer. So make sure if anything starts getting unusual, please go get checked out. To my caregivers, We love you, we appreciate you. You are amazing people. But you too need to take care of yourselves. Please, men, go and get your prostate checked. Please, go and get your colonoscopies. Please, go to the doctor, get your blood pressure. Because if you're sick, you can't help us. So, please remember to each other, take care of each other, stay on top of your tests. Make sure you go and get your echocardiograms if you have syndrome really bad, because the heart damage that is done by the serotonin. That's really, really important. How much time do I have?
You have 8 minutes.
8 minutes, okay. Randy, I'm gonna put you on the spot, baby. I'm just gonna bring you, can you come up here? Please, 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 I love you. You want to move over?
Yeah.
If I could just add one quick thing too, I know we've touched on this a number of times, but if you can, just get yourself to a net specialist. I can't say enough, I am fortunate that my husband is willing to drive me, fly me wherever we need to go, and I know financially it could be a big problem with people, but a lot of these hospitals have ways to help you financially, whether it's a place to stay, a different fee schedule if your insurance doesn't cover out of state. I can't say that enough because, you know, I was leaving it in the hands of my local oncologist after I was originally diagnosed, and it went crazy. So you just do it for yourself.
And I want to add to that, as far as the help from like the social work department at your net specialist or at your oncologist's office, it is not always financially based. So if you think, oh no, I'm financially okay, I don't need that. It's not necessarily, cancer hits everybody. It doesn't care if you have money or you don't. And there's help for everybody because you don't want it to impact your lifestyle and what you're able to enjoy in life. So be sure to check it out. It doesn't hurt to check out. And one more thing, if you've never taken advantage of Ipsen Cares or the Novartis Sandostatin copay assistance, lifesaver. I didn't know about it the first 2 years. I spent a lot of money I didn't need to spend. So, and if you want more information about that, just ask any of us that have been around a little bit.
Again, not financially.
Not financially based. So they don't look at your W-2s or whatever.
Okay, so, thank you, Mary, I'm sorry. everybody.
Sorry.
Bye.
And we just took his time.
But,
Take
so
more
if we
if you
go
want.
over. So, Randy, can you just give a quick thing and explain what you're doing in the next couple of weeks?
Yeah, so I see Dr. Maluccio. Had embolizations, bland embolizations, and got to the point where she put surgery back on the table to go in and remove the tumors on my liver, lymph nodes, etc. Looked at my last echo and said, we're going to have to wait a few. My cardiologist that I see in Georgia kind of was just like, we'll monitor it. But when she read the verbiage of that echo and saw it, she knew we had to postpone the surgery. So my wife and I got referred to Dr. Connolly up at Mayo in Rochester, carcinoid heart disease specialist. And we spent the first week in February in Minnesota. Snowed every day. I don't think it got higher than about 2 or 3 degrees. But we saw Dr. Connolly, we saw someone from their oncology team who studies under Dr. Thor. I don't know if he's been to a few of these conferences. And then met with a surgeon. So I'll be returning to Rochester 3 weeks from tomorrow. May 1st, I'll be having open heart surgery to replace tricuspid and pulmonary valves because they just, what they call severe regurgitation, basically the flaps on my valves don't even open or close. They're just stuck open all the time. So I get to go through that in about 3.5 weeks. They're going to do biological valves. I had someone in Atlanta try and say, oh, we could just do a transarterial with an artificial valve. And when you talk to an expert like Dr. Connolly and her staff, she's like, absolutely not for neuroendocrine. You know, they were basically going to treat me as someone who just has a straight up bad tricuspid valve versus any of the nuances from the neuroendocrine. Which is why it's important to see the right doctors.
You need to see the right doctor. You need to stay on top of your test. Every NET patient that has Castleman syndrome needs to have a baseline echocardiogram, and at least once a year or every 2 years. If you have Castleman syndrome, you need to go check and make sure that there isn't any heart damage. Every time you have a carcinoma crisis and you flush, you're putting serotonin into that heart and causing the damage. So you need to stay on top of it. So thank you so much, Randy. I'm sorry I put you on the spot.
No, it's okay.
All of a sudden I looked down and I was like, oh, Randy. But, you know, these are really important things. And we just want to help you make sure that you have the best life you can have. Is it easy? Hell no. I have to be honest with you. If it wasn't for this foundation and these doctors, I wouldn't be here. And every day, plan something. Plan ahead. Don't live in the moment. Don't go, oh my God, I have cancer. You have to think about the future. I always find that we book a year ahead of time, all our events a year ahead of time, and our trips to New York or whatever. And it's good because I have something to look forward to. So it's like, I don't have time to be sick. I have to keep going. I gotta go. If you want to go to Italy, you want to go to Rome, you want to go to Germany, you want to go to the islands, go. Don't hold back. Go. Because every day is a gift. That's why it's called the present. Every single day is a gift. We don't know what's going to happen tomorrow. We want you to make sure that you get all your affairs in order, whether you're 30 years old or 90 years old. Have your affairs in order. Make sure you tell your family you love them because you don't know what's going to happen tomorrow. Somebody in your family could die of a stroke or a heart attack and can be gone in moments. So it's important to make sure that you're surrounded with love and you tell everybody, I love you. And a lot of you people know, I'm a hugger. I will hug you on the way out. I will tell you I love you. I will tell you that we are here for you. So just remember that you are loved. You are not alone in this journey. There are people that care about you. There's doctors out there that want to treat you and want to make your life better. So that's what I'm going to get off my soapbox. But we love you. Thank you all for being here. It means the world to me. And have a good day. Thank you.